We interrupt this program for breaking news from the Global National Newsroom.
Hello and thanks for joining us. I'm Donna Friesen. Whether you're watching on TV or online, thanks for being with us. We're waiting for the latest update from Prime Minister Justin Trudeau. He's expected to walk out of his home at Rideau Cottage in Ottawa, where he is self-isolating in about 15 minutes. He has said that he is going to continue to work from home from the time being. And while we wait for him to appear, let's bring you up to speed on some developing news. First, the Bank of Canada rate dropped again overnight, an unscheduled drop. It's now down to 0.25%. Can't get much lower than that. And the Federal Parliamentary Budget Office is out with its forecast for the Canadian economy. It's grim. Their economic scenario assumes real GDP growth in Canada of minus 5.1% in 2020. That's not growth, that's negative. And that's the weakest on record since 1962. The scenario assumes the unemployment rate will rise to 15% and that it will remain elevated through the remainder of 2020. Under this scenario from the Parliamentary Budget Office, the deficit would increase to $112.7 billion in 2020 to 21. This scenario, though, doesn't take into account the emergency aid benefit package that the government announced, that $107 billion that will help individuals and businesses. So that's where we're at with some of the, I guess, economic developments today. Not a pretty picture. And if you haven't heard this yet, the situation in the United States is deteriorating fast, both economically, but also in terms of numbers. There are now well over 500,000 confirmed cases of COVID-19 around the world, and the United States has the most cases of any country in the world now, more than 86,000. It's rising by the minute. That means the United States has now surpassed China and Italy. In Canada right now, there are more than 4,000 people who have tested positive. Those numbers will rise today. And though social distancing is expected to help in the coming days, right now the virus is still spreading fast in this country too. Here's where the Canadian infection numbers stand today. A lot of these numbers haven't been updated yet, but Quebec has more than 1,600 cases. In Ontario, there are now 858 confirmed cases. And in total in Canada, 39 people have died. As I say, those numbers, though, will be updated as we progress through the day. And overnight, this news broke. The British Prime Minister, Boris Johnson, has now tested positive for COVID-19. He announced the news on social media.
I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating, and that's entirely the right thing to do. But be in no doubt that I can continue, thanks to the wizardry of modern technology, to communicate with all my top team to lead the national fight back against coronavirus.
So he's going to be working from home, continuing in his job. The British Health Secretary, right after that, Matt Hancock, also announced he's tested positive for COVID-19. He said he's experiencing mild symptoms. He said he will also self-isolate. He's already been working from home recently, and he too says he'll continue to play a role in the UK government response to this pandemic. But there are concerns other British politicians could be infected too. They work in very, very close quarters in their cabinet there. Downing Street itself is very small, and we know that the British Prime Minister was sort of out there actively shaking hands and being very engaged with a lot of people up until fairly recently. As we wait for the Canadian Prime Minister, Justin Trudeau, to emerge from where he is working from home, I have a few correspondents with me. David Aiken is in Ottawa. David, you're at home. Oh, no, you're actually in the studio today, aren't you? You're one of the few people.
I'm in the studio.
One of our few people who came into the office today. David, I guess we should start with the PBO, the Parliamentary Budget Office. Economic. They're not calling it a forecast so much as a scenario for the coming year.
Yeah, and they sort of underline that, saying this is just, an imagining of one kind of future. And because the situation changes so rapidly from day to day, both the health situation and the economic situation, the PBO is saying, their forecast is almost certainly, or this scenario is almost certainly to change. And you pointed out when you talked about where the deficit may go next year, a deficit almost 4 times as big as we once thought. The PBO is saying we did those numbers before the federal government early this week increased its benefit package. But if there's any little bit of good news in what the PBO said today, it's this. The PBO is saying that the federal government's fiscal position was in relatively good shape. And I know there'll be conservative-minded voters out there who'll argue this point, saying a, quote, $30 billion deficit is not good shape and we should have balanced the books. I get that there's that argument to make. But most economists, the PBO, Bay Street economists, all say that relative to the size of our economy, our deficit was very small. And that has given us, or gives us as a country, the ability to borrow more. And with this interest rate cut overnight, now 0.25%, the cost of borrowing is way below the cost of inflation. And that means that our federal government, if it should, and it likely will have to, spend billions more, borrow billions more to support businesses and workers, the PBO saying it should have the room to do so. And that may be where some of the public policy debate now goes in terms of how much can we borrow? Should we be borrowing? I know there's still a lot of business groups out there saying, particularly for small business, looking to the federal government for some help, perhaps in terms of a wage subsidy that matches what European countries are doing. The PBO would be giving some cover, I think, today to the federal government to say, if you need to borrow some more money to do that, and we're talking borrowing billions, you've got the room to do so.
Yeah, it's interesting. The Bank of Canada governor used a good line today. He said a firefighter never gets criticized for using too much water. But I guess the question is, how many mechanisms does he really have? If the interest rate, Bank of Canada rate is now 0.25%, really can't get much lower than that. Are there any other mechanisms he can employ?
Yeah, the bank is using a phrase called, this is the effective lower bound. And in non-bank speak, that means interest rates pretty much, they don't go much lower, or 0.25%. And in fact, the bank is doing something that the economists call quantitative easing, QE. And this is a term you may hear more and more from central banks around the world. And what that means is the bank is now buying up essentially debt from governments and in businesses. And what you need to know about that is the effect of that is it frees up credit. It helps banks have more money at lower risk to be able to lend to businesses. So the bank is ready to continue to do that. In the United States, the Fed has already signaled sky's the limit. They will start doing this quantitative easing to push money into credit markets so businesses can borrow. So that's one thing the bank is doing. One more thing, the PBO didn't get into this, Don. I think it's worth flagging. While the PBO said the federal government's fiscal shape is in pretty good shape, has room to borrow, a lot of provinces are not in nearly good fiscal shape. In fact, the province of Newfoundland and Labrador, it's now looking at needing a couple of billions just to meet its ongoing payroll. It's in terrible financial shape, brought on a lot by dropping oil prices. Alberta and Saskatchewan, Alberta particularly as well, went into this with a big deficit relative to its economy. It should be okay, but the provincial finances, and of course, provincial finances are all backstopped by the federal government. They'll be different from province to province. TD Bank was out this morning with its latest look at provincial forecasts, and it says that this economic hit we're going to take is really going to vary by province. And you won't be surprised to hear Quebec and Ontario probably in the best shape to weather this. Quebec and Ontario went into this crisis with relatively robust finances. Their economies were on the pickup. And of course, it was those energy-producing provinces, Alberta, Saskatchewan, and Newfoundland and Labrador, that went into this already in tough shape. And of course, you know, what was the joke yesterday? That a barrel of oil from Alberta now is cheaper than an actual barrel of monkeys, believe it or not.
Yeah, it is kind of impossible to comprehend. The other thing that I heard yesterday is that personal protective equipment that all our frontline medical staff need is now more precious than oil. And I expect that's probably true too.
Yeah, and I expect that will be something we're going to hear from the Prime Minister about today. Some more updates on that. Remember, yesterday he talked about millions of items were on the way from China, from elsewhere. We're trying to ramp up manufacturing domestically, and you know, we spent much of the day trying to get a little more details on that as well. I expect we'll hear more from that from the PM, and then later, when the ministers give their press conferences, you know, we'll want to know that. Frontline workers, firefighters, first responders, healthcare workers, they've got the masks, they've got the gowns, they've got the gloves that they need to help Canadians in this crisis.
Hey, David, quick question about the Prime Minister. He said he's going to continue working from home, though he's technically could emerge from the House now because he's been in this self-isolation for 14 days. Am I right about that?
Yes. Now, we've been trying to get a straight answer from the PMO on, well, as the health authority said he's clear to walk around the city of Ottawa if he wants. So we really can't get a straight answer, but they are telling us this. You know, this is the 16th day of his, quote, isolation. But he wants to do these press conferences from his home at Rideau Cottage to send a message that he's been trying to send all week, which is everybody, if you can work from home, work from home. And so the Prime Minister is trying to demonstrate just that he can, in fact, work from home. And just to loop back to quickly what Boris Johnson, being the Prime Minister of the UK, now diagnosed, remember, we only have one MP so far who has been diagnosed with COVID-19. That's Kamal Khera, a Brampton West MP. Lots of others been tested and had to self-isolate. Natural Resources Minister Seamus O'Regan had to do that. So did Mary Ng, the Trade Minister, isolated, tested, negative. But so far, just one Canadian MP. That's Kamal Khera.
All right, David Aiken, thank you. Let's go to our Ottawa Bureau Chief, Mercedes Stevenson, who is also working from home today. Mercedes, hello there. What are you expecting to hear from the Prime Minister this morning?
Well, I think we're looking for a few interesting things. First of all, yesterday we were talking about the possible deployment of U.S. troops to the Canadian border. The Prime Minister came out very strongly against that, and so did Chrystia Freeland, who, of course, is the Deputy Prime Minister. She said it will be damaging to the relationship. The Wall Street Journal was reporting last night that the U.S. has dropped that plan. They had that from a White House official. It'll be interesting to see if the Prime Minister comments on that, if they're very unusual public commentary, because typically they'll say, you know, anything under discussion diplomatically, we don't discuss publicly, had a result. I also think we're going to be looking for information about that equipment for frontline healthcare workers. It's been a huge issue in the United States. We've seen pictures of nurses in garbage bags in emergency rooms in New York. One nursing supervisor died of COVID-19. And there's a lot of concern in nurses here. I've been speaking to a few. I've been speaking to a few friends of mine who are doctors. And they really want to know that they're going to have access to that equipment in a timely manner. Yesterday, we heard the Prime Minister say that they have enough right now, that the federal strategic reserve they had was prepared. It's always interesting. We find out in events like this that the federal government does stockpile that kind of equipment in case of a pandemic like this one. But it's not going to last forever. And we're expecting there to be a significant shipment from China, a place that we had sent personal protective equipment to during their COVID-19 crisis where this virus originated. But when is that coming in, and when will they have access to it? And then, even then, is it enough, Donna? Because we're talking about nurses and doctors in hospitals, but keep in mind, there's a lot of people who could be on the front lines dealing with folks who have COVID-19 potentially. Firefighters, police officers, RCMP who are up in remote areas. So there's a lot of distribution there that'll have to happen as well.
Yeah, you make a very good point. And we're going to go to Jackson Prosco, who's in Washington, but he has some news about the police in New York City. And I had heard this from people in New York who were saying a lot of people are starting to phone in sick. They just don't want to do a lot of these jobs. Jackson, are you with us? What news is there from specifically about the police?
Yeah, good morning, Donna. New York police have reported the first death of somebody who worked for the police service, a custodian who passed away from COVID-19. There are more than 500 members of the NYPD who are now positive for COVID-19. That includes 440 uniformed officers, and the sick rate apparently is now hovering close to 11%. And Donna, we know there is a dire situation in New York's hospitals. They are bringing in refrigerated trucks to store bodies. Other hospitals building makeshift morgues in tents outside of the facilities. Really, it's a dire situation in that city, and New York is making it clear they're the first to get this. They are the canary in the coal mine for what the rest of this country can expect to see.
It is also so clear that the political leaders in New York City and New York State waited far too long to get enough protective equipment for all these people in their hospitals and on the front lines.
And now they're finding not much help from here in Washington. New York's governor has pleaded for 30,000 ventilators, but last night President Trump phoned into Fox News and said he didn't understand why anyone would need 30,000 ventilators. He feels that there are enough out there. So, Donna, conflicting messages and not a lot of backup support from the federal government, which is what individual states, not just New York, are looking for right now.
Yeah, and I think we're talking about New York because it is such an epicenter for the United States, but there's also now this morning a lot of cases elsewhere in the United States.
That's right. Louisiana has seen a huge outbreak. Georgia is in a bad state right now. In fact, there's one small city, Albany, Georgia, where the hospital there is so overwhelmed that they are now trying to source supplies on the underground market. Michigan and Illinois seeing rapidly escalating outbreaks as well. If New York's at this point now, they're estimating their peak is 2 to 3 weeks away. These other states, the ball is just starting to roll there now. They could be several weeks behind that. It's not clear when the peak will be in this country, but Donna, it's clear we're in for a long haul here.
And just quickly, as we wait for the Prime Minister, he's about to step out of his house, I think. What's the situation with social distancing in the United States? I know it's a massive country and the rules have been different from state to state, but generally, are people now getting the message that they need to keep physically distant from each other and stay home?
You know, it really does depend on where you are. Here in Washington, we all received text messages on our phones this week telling us to stay home, all non-essential businesses closed for a month. In Alabama, though, the governor is proudly touting the fact that there are no restrictions or anything like that in place in that state.
All right, Jackson Prosco, thank you so much.
Everyone.
Let's listen to the Prime Minister.
Let me just begin by saying I'm pleased with the supporting actions taken by the Bank of Canada this morning. Monetary policy is very important, but as the governor of the bank has repeatedly said, the most important thing we can do to help people and the economy in this crisis is for the government to take strong fiscal action. So today, I want to speak directly to small businesses and entrepreneurs. I know that for many of you, the past few weeks have been heartbreaking. You've had to slow down your operations. In some cases, you've even had to close up shop for the foreseeable future. And because money isn't coming in, you can't afford to keep your employees on the payroll. These are really tough decisions. Tough because you don't want to let the people go who help you run your company in their time of need. Tough because some of you have built your business over the course of many years, if not decades. And now it seems like this climate of uncertainty could threaten everything you've worked for. I know many Canadians across the country are saddened to see their favorite neighborhood spots closed. These are the places that make our communities feel like home. Our government knows you're really feeling the impacts of this pandemic, especially with the end of the month coming up. So here's what we're going to do to take some of that pressure off. Last week, we had announced that we would cover 10% of wages, but it's becoming clear that we need to do more, much more. So we're bringing that percentage up to 75% for qualifying businesses. This means that people will continue to be paid even though their employer has had to slow down or stop its operations because of COVID-19. We're helping companies keep people on the payroll so that workers are supported and the economy is positioned to recover from this. That is our priority. We will have more to say on this very soon, but I can tell you that this subsidy for small and medium-sized businesses will be backdated to Sunday, March 15th. For people who've lost their job or are self-employed, the Canada Emergency Response Benefit will still be there to help you. We also know that for small storefront businesses, they're struggling with cash flow right now. It's hard to raise money and make money in this climate. So to help you bridge to better times, we are launching the Canada Emergency Business Account. With this new measure, banks will soon offer $40,000 loans, which will be guaranteed by the government to qualifying businesses. The loan will be interest-free for the first year, and if you meet certain conditions, $10,000 of it will be forgivable. Our government will also provide an additional $12.5 billion through Export Development Canada and the Business Development Bank to help small and medium-sized businesses with their operational cash flow requirements. This means that businesses will be able to apply for a guaranteed loan when they go to their financial institutions to get help as they weather the impacts of COVID-19. Lastly, we're announcing that we will defer GST and HST payments, as well as duties and taxes owed on imports, until June. This is the equivalent of giving $30 billion in interest-free loans to businesses. So if you're struggling to get by right now and you have a payment due at the end of the quarter, we're going to give you more time. It will also allow you to keep the money that you would have been sent to the government and use it instead for your immediate needs. With these new measures, our hope is that employers who are being pushed towards laying off people because of COVID-19 will think again. And for those of you who've already had to lay off workers, we hope you will consider rehiring them, given this payroll support. Over the coming days, we will announce additional measures to help the most vulnerable: youth, marginalized people, people who live in poverty. We're going to have more news to share with you very soon. Ce matin, je veux parler aux entrepreneurs et aux propriétaires de petites et moyennes entreprises.
Owners of small and medium-sized businesses. I know that over the past few weeks, you've been called to make very difficult decisions. Some cannot allow for paying their employees. Others have had to close shop. This pandemic has destabilized the world economy, and the climate of uncertainty is extremely concerning. Last week, our government announced a series of measures to help you, and you've told us that you needed even more. We heard your message. Today, we are adding additional measures to help you. Last week, we announced that we would fund 10% of wages, but we need to do more. The percentage will now be 75% for small and medium-sized businesses who are eligible. This means that employees will continue to be paid, even if the business for which they're working has had to slow down or stop its operations because of COVID-19. We have employers who are able to keep their workers, support them, and this will support the relaunch of the economy. This is our priority. We will have more details on this very soon. Right now, I can tell you that this wage subsidy will be retroactive to March 15th. For those who have lost their job or who are freelance workers, the new Canada Emergency Response Benefit is there for you. We also know that small businesses have cash flow issues right now. It's very difficult to obtain funding and to make a profit. We are therefore launching the Canada Emergency Business Account. Because of this measure, banks will offer loans up to $40,000 that will be guaranteed by the government to eligible businesses. This will be an interest-free loan for the first year, and if you meet certain conditions, 10% will be forgivable. Our government will also provide $12.5 billion extra to Export Development Canada and the Business Development Bank of Canada to help small and medium-sized businesses with their cash flow needs. Businesses will be able to apply for a guaranteed loan when they're going to a financial institution to obtain help to reduce the impacts of COVID-19. Finally, our government is announcing that people will have up until June to pay their GST and HST payments and also to pay taxes on imports. This is the equivalent of giving $30 billion in interest-free loans to businesses. So if it's hard for you to make ends meet because of COVID-19 and you owe money at the end of the quarter, we will allow you more time. You'll be able to defer the payment. This will also allow you to keep more money to pay your expenses on a daily basis. We hope that these new measures will encourage employers who thought they would have to lay off their employees to think twice. If you've already gone through layoffs, we hope that you will consider rehiring your employees because of this paid subsidy. Over the next few days, we will announce additional support measures to help the most vulnerable: youth, at-risk people, those who are living in poverty. We will have news for you very soon.
I know the past weeks have been really tough. You're worried about what COVID-19 means for your business and for your future. These are uncertain times, but my message to you today is we're going to be here for you. Small and medium-sized businesses are the backbone of our economy. You are collectively the largest employer in the country. You support millions of families. You serve our communities, and you make our towns and cities better places to live. Canadians are counting on you, and I am counting on you to come back strong from this no matter what comes next. You're going to get the support you need to help rebuild a more resilient and prosperous economy. So to businesses across the country, please keep your workers on the payroll or think of hiring them back. In the meantime, let's keep listening to our public health officials. Let's wash our hands, stay home as much as possible, and keep a safe distance from each other when we go for a walk or when we have to go to the grocery store. Together, I know we're going to get through this. Merci beaucoup tout le monde.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de
Thank you.
questions.
Now the question period on the phone. A question and then a follow-up.
Thank you. Merci. The first question from Teresa Wright, the Canadian Press. Your line is open.
Good morning, Prime Minister. Could you please tell me when you expect the Americans to decide how they will or will not deploy their military in order to assist their border patrol?
As I've said, Canada and the United States benefit immensely from the fact that we share the longest unmilitarized border in the world. We have expressed to the United States that it would be a mistake to position troops near the Canadian border, and we certainly hope that they're not going to go through with that.
Has the government received formal confirmation that the U.S. will not post troops on the border with Canada, or is this still a possibility? We continue to engage closely in back and forths with the American administration on many, many issues around the border, and when we have more information, we'll share it. Les Canadiens et les Américains
Canadians and Americans are fortunate that we share the longest non-militarized border in the world. It's in our mutual interest to continue with this. That's what we've expressed to the American administration, and this is what we will continue to work on.
Thank you. Merci. La prochaine question, Émilie Bergeron, Agence QMI. À vous la parole.
Émilie Bergeron. Hello, Mr. Trudeau. Could you indicate if these benefits will be taxable? What are you going to do to help the media? Recently, we've seen a lot of layoffs. Now, if we talk about the emergency response benefit, this is like EI. And like EI, this will be a taxable benefit. We are not going to retain funds at the source. People will receive the necessary funding immediately, will receive the entire benefit. We have a progressive tax system, and so we will be able to make sure that people who need it the most will be able to benefit. Thank you. Next question.
Thank you. Merci. Next question is from Alex Valengal from the Toronto Star. Your line is open.
Good morning, Prime Minister. Just with these new measures that you're announcing, can you give us a sense of the cost? And I'd also like to know, given that the budget was originally scheduled for next Monday, I believe, when we're going to see a fiscal accounting of all these spending measures in a fiscal update or a budget?
We've announced today that we will be supporting small and medium-sized businesses with payroll support up to 75% for qualifying businesses. We know that this is going to be a significant measure of investing in Canadians and in businesses so that we can bounce back from the difficult times we're going through right now, both on the health side and on the economic side. We recognize that these are unprecedented investments in the economy, but we also know that they are necessary. They are necessary because we have to get through these coming months of restricted economic activity, where people stay at home and work from home or don't go to work as much as possible, focusing on keeping their families safe. But if we can support businesses to keep that relationship with their employees, to keep being able to pay their employees through this time, we know that coming out of this crisis will be smoother and better than otherwise. That is our focus right now. In terms of accounting, in terms of accountability, we will, of course, as was passed in Parliament earlier this week, be engaging regularly with members of the opposition, with the Finance Committee, and ensuring that people are seeing exactly what we're doing. We know that transparency around the investments we're making to support Canadians is important, not just from a democratic and parliamentary principle, but it's also important in terms of giving confidence in Canadians that this government will be there for them while they do what is necessary to keep themselves, their families, their neighbors safe, and ensure that we can come out of this stronger than ever before.
Merci. Dernière question avec un court suivi.
Thank you. Merci. La prochaine question, Michel Lamarche, TVA Nouvelles. À vous la parole.
Michel Lamarche, TVA. Mr. Trudeau, I'd like to hear you speak to this announcement that you've made today. Could you tell us how many small and medium-sized businesses could be helped, and how many employees, and how much this will cost? Of course, we are finalizing the details. We can't unveil everything now, but we hope to be able to do so by Monday. We want to make sure that what we're going to do as an initiative to help these small and medium-sized businesses will truly help these businesses to keep their employees, to continue to pay their employees, even if there's very little work. If I think of a family-run restaurant that has been existed for decades and that has had the same employees for decades, people that were there for the good times and the bad, now we're going through a crisis and they're unable to keep these employees on their wage bill in their time of need. We need to be there. And yes, the Canada Emergency Response Benefit will be there for many, many people who need it. But if it's possible, it's better for everyone. It's better for everyone to keep the link between the employer and the employee, so that, first of all, people can know that they still have a job to go back to, even if they're not working, and that they will be able to go back to their jobs, and also that we'll all be able to weather this crisis and get out of it more quickly when the time comes. We need for people to be reassured that the economy will be restarted, that we have confidence not only in our ability to keep ourselves safe, but our ability to put our economic situation in order and have an extraordinary lifestyle here in Canada. And of course, this is going to depend on the decisions we make with regards to implementation and design. We are going to make sure that we're going to do everything necessary to help businesses affected by COVID-19.
We recognize that there's still a little more design work to be done on this, and we will have more on all the details, hopefully by Monday, so people can make those decisions to keep people on the payroll, to even rehire people to be back on the payroll. Because we're thinking about that family-owned restaurant. It's been around for years, had many of the same employees for years, employees who've been there through slowdowns, good times and bad times. And now in this moment of crisis, they're having to lay these people off at their time of need. We know that allowing people to continue that relationship, allow people to continue to feel and to know they have a job, and allow employers to keep supporting those families who work with them is a really important thing, not just for people's confidence, but for the ability of all of us to bounce back strongly from this once we're through it. We need people to be focusing on taking care of themselves and their families and not worrying about what the future will bring. There's plenty of worry for right now in terms of keeping safe. That's why we are focused on being there for you. With the three measures that we're announcing today, with the Canada Emergency Response Benefit, with the payroll support up to 75%, and the significant access to credit for businesses that are squeezed, we are demonstrating that we are there for you to help us through this moment so we can come back once we're all safer, stronger than ever before.
Monsieur Trudeau, en suivi, j'aimerais vous entendre sur le scénario.
Could you speak about the scenario that was set out by the PBO, the new deficit for 2021, without looking at the measures announced today? He was talking about $113 billion. What happens with the Canadians who see the deficit exploding and who are very concerned today? Canada was in a very healthy fiscal situation. We are among the countries who were in the healthiest economic position in the world. We had a debt-to-GDP ratio that was very low, and this allows us to be able to take the necessary measures. We are confident that we are able to support people in their time of need. This is a very unique situation, and we have to invest to help people, to help small and medium-sized businesses, to help employers, and especially to help workers and families. That is exactly what we're going to do. We have confidence in Canada and in Canadians. We know that if we're able to get through this time of crisis, if we're able to remain healthy, if we can do what's required to protect ourselves and to protect others, we will be able to go back to prosperity. We have to support each other in our time of need. And this will allow us then to rebuild and to be stronger when everything will be over.
We know that these are exceptional times that have required exceptional measures of investing to support Canadians, to support small businesses, to support the economy at a time of almost total economic slowdown and shutdown. But we also know that Canada's fundamentals are strong. We have one of the best balance sheets in the G7, which allows us to make the investments we need to keep Canadians focused on what they need to do right now. Stay home, take care of their families, look out for their loved ones, with the confidence that our economy will bounce back strongly. If we make sure that people can do the things they can without worrying about the future, there's plenty to worry about right now, about today. So focus on the things you need to do today and know that your job will be there, that your relationship with your employer continues, that we are going to support you through this time and we can come back stronger than ever before afterwards. That is the responsibility of the Government of Canada, of all governments in Canada right now, and that is what we're focusing on. With the measures that we've announced until now, the Canada Emergency Response Benefit, this payroll support to 75%, and the access to credit for businesses to see them through this time. We know we are positioning ourselves not just to be able to do the things we need to do right now to keep our country safe, but we will be able to come back from this stronger than before afterwards.
Bonjour, Monsieur Trudeau, Louis Blouin de Radio-Canada.
Louis Blouin, Radio-Canada. You have access to scenarios, to numbers. There are people at home who are wondering how long they're going to be sitting at home. What can you tell Canadians as to the time this is going to take? For how long do we have to make economic sacrifice to save lives? Can this go on till the summer? We are looking at all possible scenarios. Some scenarios are more serious and last longer than others. And this really depends on the choices that Canadians will make today, on choices that have been made over the past few days and the choices that they will make in the days to come. If we continue to listen to the experts, if we continue to stay at home, to limit one's comings and goings, if we're able to protect ourselves and our loved ones, we will get out of this much more quickly. What will it look like? What will be the timeline? We know that we're talking about weeks and perhaps months. But we will see if we are flattening the curve, if we are controlling the infection rate of the virus. This will allow us to predict with a greater amount of accuracy and certainty for how long people will have to be in protection mode. We do recognize that we have to do everything possible for the necessary time.
Obviously, many different projections of how long this could last, how serious this could be, how many cases we could be facing. But those projections all hinge on choices that Canadians are making today, choices they made over the past few days, choices they will be making over the coming few days. I am incredibly comforted by the number of Canadians who are taking this seriously and protecting themselves, their loved ones, and by extension, our healthcare workers and essential workers who are so important in this time of crisis. And the measures that we've announced and the measures we're announcing today will ensure that Canadians are better able to do the things necessary to keep their families safe through this difficult time. So we will be able to say more about how many weeks or months this lasts for as we see the impacts of the behaviors that people have engaged over these days. But I am very optimistic that we're going to get through this in the right way because Canadians do what they need to do to be there for each other and to keep us all safe.
Est-ce qu'il faut s'attendre à une mise à jour économique avant
Can we expect an economic update before the tabling of the budget? And if yes, when? We're going to be transparent with regards to the measures. We continue to invest and to provide direct support to Canadians, to small and medium-sized businesses. We need to provide aid to large businesses in industries that were hard hit by this crisis. We've done a lot, but we have a lot that remains to be done. We will be transparent with regards to what we do. We want people to understand and to have confidence, but also so that parliamentarians are able to do their job and to make sure that government is doing what's necessary to help Canadians.
Prime Minister, at a time when you're rolling out all these programs that are going to require Canadians to interact with government, you're also closing Service Canada centres across the country. And I'm wondering why that decision was taken now at this time, and what is your message to people who might have trouble accessing government services, particularly people, seniors, and people living in Indigenous communities?
Over the past years, we have made significant efforts to ensure that what people can access in the physical Service Canada centres is also able to be, and more able to be, accessed online. As part of the initiative of encouraging people to stay home and work from home, this is something that we realize we can and should be doing. We want to make sure that Service Canada employees are continuing to work extremely hard to serve Canadians, to respond to their needs, and that's why things are going to be done online and through the phone. And we will be making special considerations for people who are particularly vulnerable and have difficulties accessing those services.
We understand that we need to be able to provide services to Canadians. For a long time, the offices of Service Canada are making sure that services are available online or by the phone. We're encouraging people to stay at home, to work from home. We expect that the staff from Service Canada will continue to provide services to Canadians from home. Additional measures will be taken for those who don't have the capacity to access services online or using phone lines.
In self-isolation, every time we've asked you about this, you've referred to doctors' advice. Can you tell us exactly what the doctors have told you about whether or not you have to stay in self-isolation after today?
The doctors continue to tell me to stay in, to tell us to stay in self-isolation. But at the same time, we're asking Canadians to work from home wherever possible. We're asking people to stay self-isolated as much as possible, to not go out if not necessary, and I am happy to continue to do this. Okay.
I will continue to heed the doctor's advice. They're telling me to continue with self-isolation. We're asking people to work from home if possible, to not leave the house if it's not absolutely essential, and to not put others at risk. So I'm very pleased to continue doing exactly that.
Prime Minister, did you or any of your officials know that the U.S. would deport asylum seekers turned away at Canada's border when you struck the deal with the U.S. last week?
The work that we've done to ensure that we are staying true to our values and our principles is an extremely important one. We got assurances consistent with the way that the American border officials have interacted with people who attempt to claim asylum at official points of entry, and we are keeping consistent with the Safe Third Country law.
That doesn't answer my question. It was a yes or no question, but I have to move on because you've also announced this massive wage subsidy today. Can you give us any specifics on what the conditions will be, whether there is a cap, and how many employers or which businesses it will apply to? As we said, we're going to roll out more details about this between now and Monday as we finalize it, but it's important to send that message right now, that if you're a small business who's facing the impossible choice of laying off long-time employees because there's just no money coming in and you don't know how long you're going to be able to continue to keep operating, we're there to help you out. We will send a 75% subsidy so you can keep those employees on the payroll, so you can continue to support those families who you've worked with for, in many cases, years. And we can continue to hold together those economic relationships that are going to be so important when we come out of this time of trial for Canadians, as we lean on each other and as we self-isolate and as we slow down and almost stop the economy in many ways. We need to be able to get rolling again quickly as possible once this wave passes us through. Our ability to do that will depend on our ability to be confident in our ability to take care of each other while we're doing it. And that's what we are focusing on right now.
Hi, Ashley Burke, CBC News. Prime Minister, there is a lot of uncertainty and unknowns right now, but Canadians are looking to prepare, and they are looking to you for guidance. Should Canadians prepare for another 5 months in self-isolation at home? As I've said, the extent of and the length of time that we will have to be self-isolating and going through this freezing of economic activity is very much going to be linked to behaviors and choices that Canadians make right now. If people are diligent about self-isolating, about staying home, about not risking contact with others or further propagation of this virus, then we will be in for a much shorter time in isolation than others. But this is why it is so important and why we are impressing upon Canadians the importance of being responsible in your choices right now, washing your hands often, engaging in social distancing, physical distancing, 2 meters apart from others, not going out unless you absolutely have to, and staying at home. If people can do that, and as we are supporting people enough to allow them to be able to do that, we know that this will last less long.
Right, Mullen, Global News. Agriculture groups and others are urging your government to drop the planned increase of the carbon tax as of April 1st. Is that something you're considering?
we know that it is important that we put more money in the pockets of Canadians at this point when they're stressed. Our plan on pricing pollution puts more money up front into people's pockets than they would pay with the new price on pollution. We're going to continue to focus on putting more money in people's pockets to support them right across the country. We know that this is an important measure for the future, and we're going to continue to ensure that we are thinking about the future while at the same time we ensure that people can afford to make it through this crisis in the best possible way.
So yes or no on carbon tax? Will it go up next week?
We continue to make sure that people have more money in their pockets because that is how we designed the price on pollution.
Merci, c'est ce qu'il m'a fait à la conférence de presse d'aujourd'hui.
Merci tout le monde.
All right. That is the Prime Minister finishing up for this Friday, March 27th, his update from outside his house, where he says he's going to continue to stay, even though technically he could come out of self-isolation now because he's been there for, I think, 16 days. But he said today that he's going to continue because everyone else is working from home if they can, and he can. So he's going to keep that up. David Aiken was listening into this. David, that was an interesting non-answer to the issue of the carbon tax. But what else did you take away from this? The big picture is the wage subsidy, which is what a lot of people, a lot of businesses had been calling for across this country to give them some support, some wage subsidy so that they wouldn't have to lay off their employees, even if there's no work for those employees to do. Because once you lay off people, once you get rid of them completely, it makes it much, much harder to restart once this whole thing is over and those businesses can get back on their feet.
Yeah, precisely. So the aim of this dramatically increased wage subsidy, and once again, let's repeat it, small and medium-sized businesses will be able to access a wage subsidy for their employees of 75%. On top of that, small and medium-sized businesses can establish a new kind of Canada Emergency Business Account. That will give you access to a $40,000 loan. The loan will be interest-free over the first year, and under certain conditions, the feds will forgive you up to $10,000 of that loan. So what's the objective here? Obviously, the first one is immediate relief for businesses to be able to help maintain their employee base. That would help employees as well, perhaps, avoid having to go on EI. So that's the first part of it. But as you said, we want to come out of this health crisis and be able to quickly and strongly have an economic recovery. And so if an employer has that same group of employees that an employer has been able to retain through this, boom, we can get things going once again. So sort of a two-pronged effort. And I can tell you, we've been looking online at some of the reaction to this. Perrin Beatty, the president of the Canadian Chamber of Commerce, very pleased with this wage subsidy. It's something that business groups have been asking. I just saw from the Canadian Federation of Independent Business as well. They're the chief lobby group in the country for small and medium-sized businesses. Big thumbs up. And Alberta Premier Jason Kenney, also a big thumbs up. But as Jason Kenney and others note, we definitely want to see details about this. The Prime Minister said details coming Monday. For instance, is there going to be a cap on the total amount of wage subsidies? Is it just open-ended over time, or will there be a cap? That's going to be an important detail. And also, I think a lot of people have a good idea what a small business is. How big is a medium-sized business? Is it something up to 500 employees, 250 employees? Depending on which organization is counting small and medium-sized business, it can be different. The Prime Minister couldn't say how big a business can be to access this wage subsidy, again saying that we're going to have this come on Monday. But definitely big news, and it's going to cost a fair amount of money, but as we were saying before the Prime Minister talked, the PBO saying the federal government does have the capacity and the good name financially, if you will, to be able to borrow money and drive up the federal deficit.
And certainly part of the long-term planning in this is figuring out how not just to support those workers who have already been laid off, and that's part of the emergency payments that will be going out sometime in April, that $2,000 a month for 4 months. But this is to keep businesses basically in an operational position, right? So even if they've sent their employees home, those employees will still get paid, and then they can just presumably come back pretty quickly.
Yeah, I mean, and that's absolutely key. So let's say that coronavirus as a certain U.S. president said, disappeared magically all of a sudden tomorrow, it would be very important that an employer could phone up their employees and say, right, let's get back to work. Because we do know, Donna, I think it's important to point out, that even though obviously service sectors have had to lay off tens of thousands, hundreds of thousands of people, there are some sectors that have been quick to hire. We've seen Walmart out there saying we need to hire 10,000 people. In the United States, Amazon is ready to hire 100,000 people. And so if this rapid shift happens and people leave their current employer to go join a new employer that is trying to ramp up to sort of deliver business in this new environment, that hurts the old employer, who now will have to find a new employee, train a new employee, and will not be able to restart a business as quick.
All right, David Aiken, thanks. Let's go to our Ottawa Bureau Chief, Mercedes Stevenson. Mercedes, that's going to be very good news for a lot of businesses. A lot of organizations, as David said, had been pushing for this. A lot of small businesses in desperate, dire straits, not wanting to shut down, but sort of in a position where they had no choice anymore since this virus has just killed business. What did you take away from what you heard today?
Well, I think that this is an absolutely massive aid package that will help a lot of small and medium-sized businesses to keep people on the payroll or to hire them back. It means the government was hearing this consistently, and I know we kept hearing it from viewers and from small businesses who were reaching out, and medium-sized businesses saying, I don't want to lay people off, I want to support people, but there is no income right now. So this is also something we've seen other countries like Norway do. He'd been asked repeatedly about that at press conferences. What you're seeing here, I think, is a progressive response from the government. As the crisis goes on and gets worse, they're preparing to announce different things on different days. A big boost there, too, in terms of export development, not having to pay the GST and HST, as well as taxes on imports. They were saying that's the equivalent of billions of dollars in loans to businesses. So hopefully this will help Canadians across the country, one, who still have jobs but are worried they might lose them, for those business owners who want to be able to keep people on, and to help relieve some of that anxiety, as well as putting money into people's pockets. Still a lot more to be done on this, as he mentioned, for people who are poor, people who don't have means, people who are homeless, youth, the elderly, who are particularly vulnerable right now. One quick thing I want to note, Donna, I know we don't have a ton of time. Before I mentioned protective gear for frontline responders, I did hear from the mother of a paramedic. We didn't mention paramedics. They, of course, are frontline and critical to this, so I just want to make sure that we do take the time to acknowledge them, because I think it's critically important we acknowledge everyone who are putting their lives on the line in this time of national crisis.
Absolutely certain that we need to do that. Thank you, Mercedes. One thing about this, what we've been talking about, this program for small and medium-sized businesses, the wage subsidy, is that it's backdated to March 15th. And one of the things the Prime Minister said is he hopes not only will businesses take advantage of this going forward, they can backdate it to March 15th. And he asked that businesses who have already laid off people hire them back.
Yeah, I thought that was so interesting. I wasn't unprepared for the announcement on small businesses. I thought there was a strong likelihood they'd have to do something there, but I didn't expect the backdating or the appeal to ask people to hire people back. I think that that might put a lot of people back into work. It also helps the government because it will take them out of the EI lineup. If you don't have to have people going on EI, it's better to have them on the wage supplement for the economy when we come out of this, because otherwise you have a whole bunch of businesses that have to start from scratch, and it delays that economic recovery even further. But if those people remain on the payroll and those businesses are poised to spring back into action, then they're able to do so.
All right, Mercedes Stevenson, thank you so much. We're going to have all the latest information on all his economic measures and the latest numbers in Canada coming up throughout the day on all of your local news programs and on Global National, always on globalnews.ca as well. Here's a quick recap of the Prime Minister's update from Ottawa today. He said it was a good thing that the Bank of Canada had made that unscheduled drop of the key interest rate. It's now down to 0.25%. The Prime Minister said more needs to be done, though, and he announced wage subsidies for small and medium-sized businesses, 75%, up to 75% for those people, those businesses, to keep people on, and that will be backdated, as we said, to March the 15th. There's also a new loan guarantees for those businesses, loans that would be backed by the government, up to $40,000, which will be interest-free for the first year, and up to $10,000 of that will be forgivable if certain conditions are met. The Prime Minister also said further details will be out soon on all of this, and he hopes the measure measures will help small and medium-sized businesses, as we said, keep their employees on the payroll or even rehire them if they've already laid them off. Prime Minister also promised there'll be more help for the most vulnerable, including those who live in poverty in this country. A lot more details coming out in the days ahead. So also the constant reminder, this will change. All of this will get back to normal if we all stay home and practice physical distancing. Can't reinforce that message enough. Thank you so much for watching. We'll see you again later in the day.
This has been a special report from Global News.
Focus on the health crisis. Right. So we're actually now just seeing that federal ministers have gathered, are assembling for their press conference. We see Foreign Affairs Minister Chrystia Freeland, the President of the Treasury Board, Jean-Yves Duclos. Looks like Dr. Howard New of the Deputy Chief Public Health Officer is also there. So let's listen into this latest update from federal ministers and health officials. Thanks, Peter.
Sorry to be late. Et merci.
Thank you very much for being with us today. I apologize for being late, and thank you for waiting.
I'll start with our daily reminder to Canadians. We must practice social distancing. Please stay at home unless you are doing essential work, like stocking our grocery shelves or working in healthcare. I know that this is really hard, but this is our country's best defense against this global pandemic. Please keep it up, everyone.
I'll start by reminding everyone daily that we have to practice physical distancing, stay home, and except unless you have to do essential tasks such as stocking up on groceries or if you need health care. I know that it's difficult, but this is our best defense against this virus. Don't give up, please.
So, today we will hear from Canada's Deputy Chief Public Health Officer, Dr. Howard New,
and we'll hear from my dear colleague, the President of the Treasury Board, Mr. Jean-Yves Duclos. Mr. New.
Bonjour tout le monde.
Bonjour à tous. Hello, everyone.
Over 530,000 cases of COVID-19 affecting all countries. In Canada, there are 4,043 cases, including 39 deaths. These are based on up-to-the-minute COVID-19 laboratory testing results. But it is important to know that at any point in time, there are many other people under investigation, awaiting laboratory tests, or not being tested at all. For this reason, even if you are not hearing of cases in your community, it doesn't mean there are no cases or that there are no exposures waiting to happen. We have now tested over 165,000 people in Canada, which is more than 65,000 additional people tested since Monday. On a per capita basis, that's more than 4,300 per million population, one of the highest rates in the world. In terms of the severity of COVID-19 in Canada, the percentage of cases that require hospitalization remains at about 6%. Those who are critically ill account for about 2.5% of cases, and 1% of cases have been fatal. Severity and fatality rate aren't just a function of the virulence of the virus. The fatality rate will be higher among high-risk populations, which is why we must do all we can to protect the most vulnerable among us. Another cause of increased mortality is overwhelmed health services that are unable to provide intensive care to a high volume of critical cases. For this reason, we must all work to flatten the epidemic curve and protect the health system.
I would like to remind Canadians of all ages, do not underestimate the severity of this disease. Every Canadian must follow the advice of public health and heed the dire warnings from other countries who did not have the chance to start soon enough or fight hard enough. We all must strictly adhere to physical distancing, comply with self-isolation orders, and protect and support those who are most vulnerable.
I am reminding Canadians of all ages Do not underestimate the severity of this disease. Every Canadian must follow the advice of public health and heed the dire warnings from other countries who did not have the chance to start soon enough or fight hard enough. We must all strictly maintain physical distancing, comply with quarantine and self-isolation orders, and protect and support those who are most vulnerable. La Nouvelle-Zélande
New Zealand has introduced the concept of staying inside your bubble and knowing what this bubble is. It's a great way to conceptualize the zone of protection that we need to have around us to keep the virus out. The optimal protection comes when each person has their own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or 4 or 6 people, all keeping within a bubble that no one else comes into. Whatever your situation is, stay in your bubble, and please don't step outside of it or burst anyone else's bubble.
New Zealand has introduced the concept of knowing and staying inside your bubble. This is a great way to conceptualize the zone of protection that we need to have around us to keep the virus out. The optimal protection comes when each person has their own separate bubble that is a 2-meter circumference around us. But for couples, families, and other cohabitation situations, that bubble might mean 2 or 4 or 6 people, all keeping within a bubble that no one else comes into. Whatever your situation is, stay in your bubble, and please don't step outside of it and don't burst anyone else's bubble. Thank you. Merci.
Okay, thank you very much, Dr. Jean-Yves?
Jean-Yves? Thank you very much, Christian. What's happening right now to the Canadian economy, there seems to be it's like a plane stuck in a major storm. And we're trying to land this plane keeping passengers safe. And that's exactly what we did 2 years ago with the Canada Emergency Response Benefit, safely and protect their health. We're going to give people $2,000 a month so that they can take care of their health and that of their loved ones. And we also want to ensure their economic security so they can put bread on the table. Today's for businesses, we want to give them quickly funding to help SMEs in coming weeks and months. The second measure that we're announcing is that, which is just as important, is a 75% wage subsidy for the large majority of companies that want to continue to work and hire employees, but they need liquidity. They need money to keep their employees and keep paying salaries to their workers. So these are major measures that so that we can make our planes safe and so that when we do take off in a few weeks, so that we can do so with a solid economic plane that protects workers, and we will take care of them in the coming weeks and months.
Okay, thank you very much. We're ready to take your questions now.
Nous allons maintenant passer à la période des questions. On va commencer par 3 questions au téléphone.
3 questions from the phone.
Une en français et une en anglais.
Thank you. Merci. We will now take questions from the telephone lines. Nous allons maintenant passer à la période des questions. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, notre première question is from Micheline Laflamme avec Radio-Canada. Please go ahead. Your line is now open. À vous la parole.
Merci.
Thank you. Ms. Freeland.
Est-ce que
the discussions that you've had with respect to U.S. troops at the border, are these over? Do you have any assurances from the U.S. government that this idea has been set aside? Answer. For the Americans, well, it's up to them to make announcements with respect to their decision. But I can tell you that yesterday and today we continued discussions with on this topic with our U.S. allies. And I believe and hope that they were listening. Canada's position was absolutely clear and strong. We explained that, in our opinion, having troops at the borders, at the Canadian-American border, is not necessary. And we explained that for us, a measure such as this, well, we should actually be managing our bilateral relationship.
It is really for our American neighbors and allies to make announcements about their position. Having said that, we have continued our discussions very energetically yesterday and today. I was in touch last night and this morning with our Ambassador Hillman to the United States. Canada has continued to express clearly and forcefully its view that there is no logical reason to militarize our border with the United States. And we have been very clear also that such an action would damage our relationship.
My second question is for Dr. New. I would like to know, what is the government or what are you doing to help provinces to accelerate the screening analysis process? We've seen a large gap between the various provinces. For example, there are thousands of people waiting in Ontario. So what are you doing in this respect? Also, given what you're seeing right now, do you think that the measures that have been taken to date could help to flatten the curve? Thank you for your question. Technically,
Dr. Tam
and myself have worked closely with our provincial and territorial counterparts and ministers from all these areas. This is a key issue, and we continue to work on this to help provinces with their ability to analyze the samples for COVID-19. To date, we know that capacity is something we can support by bulk purchasing resources such as test tubes and other key material for lab analysis. But at the same time, we continue to accelerate evaluating other technologies. For example, in English, there's supportive care and rapid testing.
C'est aussi quelque chose, on travaille avec nos collègues à notre laboratoire national de microbiologie, parce que si on veut utiliser une autre nouvelle technologie, c'est aussi important, c'est validé.
If we do want to, we have to validate it. If we do use a test that is not reliable, it could lead to false positive or false negative results. So we do have to do the necessary work to ensure that if we do use other technology for testing, that it is reliable. And we're also continuing to work on another aspect. We're looking at other technologies, such as serology. So we're looking at all means necessary. We're working close with our counterparts to ensure that Canadians will have access to the necessary testing. Thank you. Next question.
Thank you. Merci. Our next question, notre prochaine question is from Janice Dixon with the Globe and Mail. Please go ahead. À vous la parole.
Hi, my question is for Deputy Prime Minister Freeland. I'm wondering if you can tell me if Canada knew that the U.S. would deport asylum seekers turned back at Canada's border when it struck a deal last week.
Thank you for the question, Janice. That is an issue which we are currently discussing urgently with our American partners. It is very important to Canada to abide by our international commitments, very much including when it comes to refugees. We are aware of the problems of refoulement, and it was and continues to be important for Canada to have assurances that would not happen to people returned to the United States. So this is an issue which we are urgently discussing now.
Would Canada consider, reversing the policy again if there is evidence that the U.S. is going to deport those people?
I always think negotiations are best conducted in private, and I don't like dealing in hypotheticals. But let me be clear about Canada's position, which is it is important for us to abide by our international commitments when it comes to the treatment of refugees, and we are very alive to concerns around refoulement.
Thank you. Merci. Our next question.
And we were clearly alive to those concerns at the time that these agreements were announced.
Thank you, Deputy Prime Minister. Next question on the phone, please, before we turn to the room.
Thank you. Merci. Our next question. Notre prochaine question is from Lena Dibb avec la presse canadienne. Please go ahead.
Oui, bonjour. Moi, j'ai une question à propos de
l'annonce d'aujourd'hui. Je croyais que la PCU, il y a 2 jours, allait assurer le maintien du lien d'emploi entre entrepreneurs et ses employés. Alors, pourquoi est-ce qu'il nous a fallu aujourd'hui faire this new measure, this 75% subsidy for SMEs? Is that because this wasn't being done? Jean-Yves, perhaps you could answer that question in French, since, and then I'll answer in English. Jean-Yves.
Thank you for your question,
and you're exactly right. We announced the SCRB on Wednesday so that we could keep a link with employers. We know that keeping a job is important because workers are very anxious right now, but we also have to look to the future for companies when they want to bring people back to work. And that's why we announced this morning, and to go beyond this, so that employers will be able to keep their ability to keep paying employees' wages in coming weeks. Given the situation that is evolving, we're offering a 75% wage subsidy, and this will allow employers not only to keep their link to employees, but also to keep them on payroll.
And if I could just add, today's announcement by the Prime Minister on the 75% wage subsidy was a very important announcement. As Jean-Yves has said, our government, the Prime Minister, understand very much the seriousness of this situation. We understand, as we heard from Dr. New just now, that the health situation is likely to get worse before it gets better, and we understand that the economic impact is serious. And so we know that the government has a duty to do whatever it takes to allow our economy to weather the storm. By committing to a 75% wage subsidy, the government is taking a major step to help small businesses get through this intact, and it is taking a major step to do something which is so important for Canadians, and that is to keep that connection with their employer. So important to know that you have a job right now, even if the conditions of physical distancing are making it hard to go to work, even if those conditions are making it hard for your company to operate as usual. We get that, and that is why the Prime Minister announced this essential step this morning. And I would point out that the Prime Minister made clear that these measures will be retroactive to the 15th of March, and we very much hope that companies will take that into account and will hang on to their employees and will perhaps bring back people they were thinking of laying off. We're all in this together, and it is so important to keep our economy strong. We acted earlier to be sure that individual Canadians were not penalized for doing the right thing and staying at home to socially distance because of the coronavirus. The measures today are about being sure that Canadian small business is not penalized and indeed has the resources that it takes to weather this storm. And I do also want to say, this is a difficult situation. We can't mince words about that, and it is certainly going to get worse before it gets better. But what the Prime Minister said this morning is a further assurance to Canadians that our government will do whatever it takes to keep Canadians healthy and safe and to keep our economy intact during this situation and to ensure that economically we are in a position to come roaring back when the health crisis has abated. Canada has the ability to do that. We have an exceptional healthcare system. We have a very strong federal fiscal position going into this crisis, and we are going to use that position to be sure that Canadians weather the storm and that we are all in good shape and able to shovel our way out when we are able to leave our houses and get back to work.
Ma question de suivi, il y a 2 jours, vous avez dit que la PCU
that the CERB would allow companies to not lay them off, but keep paying their employees, and that Ottawa would give the money directly to these people who are still employees but without revenue. Now you're changing course. Is that because the companies refused to do what you asked them to do 2 days ago, to keep their employees on the payroll? How come? Well, we've seen the layoffs from companies in recent days at Cirque du Soleil and others. How come you're offering this now? 3 important things. First, there's a general context. We're trying to land this plane, and there are some passengers, workers who have to be protected, and that is the objective of the CERB that was announced on Wednesday. We also saw that the plane itself needed protection. The motor needed to be protected so that we could kickstart the economy in a few weeks. And that's what we did with today's announcement. We've given SMEs emergency funding that they'll be able to use. There'll be $40,000 in loans. The minister will give us more details soon, but the very fabric of SMEs is fundamental to Canada's economic growth, and we have to give them funding so that when the economy does recover, SMEs will be protected, and that's why this morning's fund that was announced is so important. We're telling entrepreneurs in Quebec and elsewhere in Canada, we're there for you. We are going to support you so that we can protect you in coming weeks, and so that we'll be able to count on you once again when the economy will rebound in a few weeks. Third, there's a complementarity between these 2 benefits. Employers need employees and vice versa. So that is why these 2 measures go hand in hand. We know that companies have already announced that their connection to their job would be maintained, but with this morning's announcement, they'll be able to continue to pay these employees.
companies who are eligible will be able to call their workers back quicker than possible. Of course, they won't lay them off because this connection to their employer will be maintained, but they'll be able to offer them salaries and they'll be able to call them back quickly if conditions allow them to do so. And what's more, companies who would have laid off employees without salary, what we're telling them is that a 75% wage subsidy will be paid by the Canadian government. So think quickly, know that we'll be there to support you in coming weeks, and a 75% wage subsidy covered by the Canadian government offers you a possibility not to only keep your connection with your employees, but also it allows you to, in coming weeks, to continue to keep them busy and being paid, because we're there to protect you, your company, and we're also there for employees who we need so greatly in the short term and also in the long term as well.
Sentences in English on that. I think it's important to see the very strong measures announced by the Prime Minister this morning as complementary to what we have already done. The first step economically taken by our government, quite rightly, was about protecting individual workers, individual Canadians. And it was above all about ensuring that there was no economic reason for people to avoid doing the hard and necessary action of social distancing and of staying home if they were unwell, if their children couldn't go to school, if they needed to care for people who needed to stay home because of coronavirus. We understood that we were asking Canadians to do something that is not only socially hard, but that could have borne a real economic penalty for a lot of people. So it was important to act really swiftly to put some measures in place so that Canadians knew that doing the right thing on the health front would not hurt them economically, and to support all those Canadians doing that. The strong action the Prime Minister has announced today is very complementary to those steps and is all about ensuring that our small businesses, the backbone of our economy, are able to get through this intact, viable, still connected to their employees, and that when this period of social distancing comes to an end, as it inevitably will, that our economy is in a position to come roaring back, and that Canadians still have their jobs. That's what the Prime Minister announced today, a very, very important step, and it should give Canadians a lot of confidence that the government is prepared to do whatever it takes to keep our economy strong.
Merci, Madame la Vice-Première Ministre. We'll turn to the room.
Thank you.
Rachel Haynes, CTV.
Ministers, Rachel Haynes from CTV. My first question for Dr. New is about national guidelines for hospitals who are going to be experiencing or expecting to experience a lot of critically ill patients coming to hospitals over the next few weeks. We've seen a lot of deaths across the world, and a lot of families too are reaching out about critically ill patients whose families are on ventilators and they're not able to be by their side given the measures that are in place right now. Are there going to be national guidelines sent out to hospitals to deal with this reality, or will Canadians have to face the fact that they may not be able to be with their loved ones at this time?
Thank you very much for the question. This is among the many live issues we're actually dealing with at what we call an FPT, or federal, provincial, territorial level. As I said again, in terms of my level, in terms of public health, the Special Advisory Committee is meeting practically on a daily basis to look at this. present time, and others are maybe not as far along, but certainly we need to anticipate and plan for that possibility in those provinces as well. So at the end of the day, we are looking at frameworks and approaches so that, as you say, at the end of the day, all Canadians across the country will have access to the healthcare services that they need.
Okay. My question was more about families who would like to be with their loved ones. If their loved ones are in hospital, how can you visit them? And is that a reality now that you're just not going to be able to see your family? But I would also like to follow up on the testing that you said, is that you said that we have one of the highest rates of testing in the world right now. But there are results backlogs of about 10, 11, 12 days that we know of. So why is it so important that you're promoting these numbers of tests, but we are not seeing the results? So how is that a good thing that we have all these tests, but we don't have any results yet?
Okay, so to the first question, as we all know, physical distancing is the most important measure we have in place right now to prevent further transmission of the virus. So certainly at a local level, we can appreciate it's very difficult for families that have a loved one that's in a hospital receiving care. And so I would defer to the hospitals. Obviously, they're putting measures in place. I think many hospitals have limited or basically said, no, there's no visitors allowed. People, I think, understand that the need to be able to protect other patients and also the staff in the hospitals from potential further exposure to the virus. And I think the message we've been giving loud and clear is that everyone should stay home. You only go out for essential activities such as buying your groceries. So I think with that principle in mind, I think people understand, get it, why we shouldn't have, let's say, visitors in hospitals. To your point about the testing, we have one of the highest testing rates, and the results I've been giving you are the testing results. So we know there are a lot of tests that are still in play, as they say, are still waiting to be analyzed. And of course, we can do better. And I think the provinces are stepping up. I'm aware, for example, the province of Ontario, Quebec as well. They're all stepping up in terms of their capacity, in terms of a faster throughput, if I can put it that way. But in terms of the faster throughput, as I mentioned earlier, it's based on the current technology, the gold standard, which is still the PCR test. So that's with the swab, sending the swab in, the sample to get analyzed with a PCR machine, etc. The other things we're looking at is that are there other testing modalities we can also use? So, for example, we're talking about point-of-care tests that also would be able to give results in a much shorter time and also be closer to where the care is actually being delivered. As was mentioned earlier, these types of tests, if they become available, and we hopefully expect sooner rather than later, will be a godsend for certain types of situations, for example, in remote and isolated communities, that will also decrease the testing time. Because right now, with the current technology, they have to send the samples. You can imagine physically by an airplane to go down to a reference laboratory to get that test result. So we're looking forward to having that kind of technology available as well. But that takes a bit of time. And as I mentioned, I think in French earlier, we need to validate those tests, because there's nothing worse than having a test out there that doesn't give you what we call valid, accurate results. There's nothing worse than being sort of falsely reassured and not knowing if you have a false positive or false negative test result. So we need to have those tests validated before we're able to roll those out across the country. And then finally, as I mentioned before, there's also serological testing, which would be another, as they say, tool in the toolbox, not to use too many sort of things like that, anecdotes, but it'd be another technology we would have in our suite of testing technologies. So with all those things on the go, we, as I said before, in terms of even the increase in our testing results, look how we've increased over the past few days. And if you look at countries around the world, by sort of what I understand, we're like number 2 or 3. I think it's only the United Arab Emirates and I think South Korea that had a higher testing rate per million population than we do. We're about the same as Australia right now.
Thank you, Doctor. Next question, Julie Van Dusen, CBC.
Hi, it's either for Ms. Freeland or peut-être Monsieur Duclos, I'm not exactly sure. But so your government brought in the emergency benefit that's going to give people $2,000 for 4 months. So I'm assuming you chose 4 months because you think it's going to last 4 months, the pandemic, but I'm not sure. The PBO, his report today, he estimates that this will go on for 6 months until August. So what timeline is the government planning for? that we will live like this?
So I'll start, and I am actually going to ask Dr. New to offer some comments because that is really a question about public health. And let me just say this. We do know that the health situation is going to get worse before it gets better. And all of us at the federal level, provincially, in cities, in hospitals across the country, are preparing incredibly energetically for that inevitability. All Canadians are working really hard to make that worst case scenario as least of a worst case as possible for Canadians. And every single person who is physically distancing, every single person who is making the big sacrifice of not visiting a parent or a grandparent in a long-term care facility, every child who is not going to school is contributing to a better health outcome for Canada, and a better health outcome will mean a better economic outcome. In terms of how long this will last, I would love, Julie, there is nothing I would love more than to be able to say to you and to Canadians, on this specific date, it's going to be all over. But it's so important to be honest with Canadians, and it's important for all of us to live in the truth with this situation, and only by being honest with each other are we going to get through it. And being honest with each other means our best experts, and we'll hear from Dr. New in a minute, cannot tell us with certainty precisely when this will end. They can tell us that it will end, and they can tell us the things that we can do to get through it with the best health outcomes for Canadians. And then our job as a government is to take the necessary economic measures so that those actions we're taking to keep Canadians healthy, safe, and alive do not hurt our economy and don't hurt individual Canadians. So that is what we're doing. And I will leave it to Dr. New perhaps to offer a bit more of a health perspective. We're looking at a lot of scenarios. Provinces are looking at a lot of scenarios, and our healthcare scenarios are very much connected with the economic thinking that we are doing. It's one reason why you're seeing the economic thinking developing, why you are seeing new proposals coming out very regularly, because this is an evolving situation. Dr. New, and then maybe Jean-Yves would like to add something. Ça va?
What I can say is that from the public health perspective, there's a tremendous global collaboration. We're in regular contact, Dr. Tam, myself, and others, with the World Health Organization, with our partners internationally, such as the CDC in the United States. We're constantly sharing information, best practices, looking at the experience of what's happened, what's worked, what hasn't worked in other countries, the changing epidemiology, looking at the science and the evidence, and using like I say, the best measure we have at the present time, which is physical distancing. And the reason for that is that we're trying to buy time. We talk about things like flattening the curve, planking the curve. It's all to buy time, to not overload our healthcare system. As scientists around the world, including ours in Canada, are working day and night to try and find that vaccine, that treatment that would help also lessen the burden of illness, both here in Canada and around the world. And I guess to your question, we're in it for the long haul. It's not going to be days and weeks. It's definitely months, many months. And the one thing that other countries are also looking at, and we're looking at as well, is there a possibility of a second wave? Who knows? I think Dr. Tam mentioned it. I would agree with her. We're looking at all possibilities and planning for all potential scenarios.
So briefly, I would just add that despite the uncertainty that we all see, both on the health side and on the economic side, we really need to, and I see we, the federal government as well as all governments, we need to demonstrate to Canadians that we are there to help each other. and that we are there to provide the hope that we need to go through this crisis. And that hope is better supported when Canadians understand that from certainly both a health and an economic perspective, we'll be there to support them. So this morning's announcement is exactly that. We're going to support you, both the workers and the small and medium-sized businesses and everyone else important in our economic fabric, because we all need to go through this together. So confidence and feeling that we're all there to support each other are key, not only messages, but key actions, items that we are again delivering today.
Dr. Tam, my second question flows out of what you've just said, and that is, you've repeated often that it's going to get worse before it gets better. What do you mean by worse? What does that look like? And what's being done to prepare for a surge, I'm assuming?
So we always prepare for the worst, but hope for the best. In terms of the worst is that we've already seen the experience in Quebec, where they've had a spike in cases. Part of it, I think, and I've been communicating closely with colleagues in Quebec, is due to the fact that they've decentralized their testing. So before, it was all the laboratory results had to be verified at sort of the provincial lab level. Now I understand there's a network of 10 laboratories, so they're able to actually do the testing and have the results come out sooner. They're also saying that part of the spike is because Quebec, compared to the rest of Canada, their March break was earlier. So I think it was at the beginning of March. And therefore, we're now seeing, as we always know, because of the delay in terms of people having been exposed, and then now we're getting the results of people who become ill and get their test results. That's why that explains in part the spike of cases in Quebec. So in terms of the worst, as we know, Ontario had their March break a week later. We, I think on Friday 13th, March the 13th, told Canadians, hey, avoid all non-essential travel outside of Canada. Many people before, maybe just, even during that time, were still going on their vacations outside of the country, etc. We also have the snowbirds, etc., and many other Canadians around the world. And we know that there's an increased risk of exposure to COVID-19 in many parts around the world. So with these people now coming back, we're telling people physical distancing is so important, but it remains to be seen what comes of it in terms of these people maybe becoming ill with COVID-19 and then seeking medical care, getting tested, and getting those results. So that's what we might anticipate as sort of being the worst, and then hopefully now with everyone understanding the absolutely critical importance of physical distancing, that hopefully in the weeks to come we will see the effects of that positive measure. The other point maybe I'll make at this point, because I understand there are some questions have been out there in terms of the mandatory order under the Quarantine Act that came into effect, and maybe I'll just want to walk people through that, because I know there's been maybe some confusion in terms of quarantine, self-isolation, what happens to travelers coming back. So I'd like to maybe unpack that to make it crystal clear to all Canadians. That's the next step in terms of making sure that we don't add to the surge. The surge might be what happened a few weeks ago, and the measure we're putting in place is to prevent an even a further increase in that surge. If you'd like me to get... Okay, so with the mandatory order under the Quarantine Act, all travelers coming to Canada now are subject to an order of quarantine, and that's a serious issue, and certainly that's a very strong measure that our Minister of Health, Minister Haidu, put in place on March 25th. And so the easiest way to look at it is that you have people who come to Canada who might be ill with symptoms, maybe arriving at a land border, or maybe even by air, even though they could or should have been checked before they boarded their flight. And of course, what we call travelers coming back who have no symptoms and look and feel well. So the ones who are ill, that's straightforward. It's always been in the Quarantine Act. If you have an ill traveler at the border, certainly with our quarantine officers, we would take charge of these people, make sure they get the appropriate medical follow-up, isolation, make sure that we do it in the best interest of their health, and also obviously to protect Canadians here in Canada. I would remind people also that it's in everyone's best interest, including the traveler, to declare if you're not feeling well at the border. I've heard stories about people maybe hiding symptoms, etc.
I can give you an anecdote. There was an individual, not giving away any sort of medical confidentiality, that arrived at the border, wasn't feeling well, was taken into quarantine, and in a number of several hours later, deteriorated rapidly and is now in an intensive care in a hospital. So it was good that that person was honest and told us about their symptoms. So that just gives you an example of the seriousness. Now we're saying that for asymptomatic travelers who come to Canada, get home as fast as you can. If you're asymptomatic, you're still well, the direction is go home as quick as you can by the most direct route. Do not stop for groceries. Just get home. If that means an onward travel with a domestic flight, we will give you a mask and make sure that you get home safely. And once you're home, you are under quarantine. That means you stay home. If you have a property, you want to get some fresh air and you have a balcony or your backyard, yes, you can go out there, but that's it. No bike rides, no walking around in the neighborhood. You are under quarantine. I don't know how much clearer I can make it, but that's it. So that's really what we're putting in place, and I hope Canadians and everyone understands that is the expectation requirement under the Quarantine Act and the order that's been put in place. Thank you.
I just want to add one thought, Julie, to your question about a surge, which is, talking about surges, talking about the reality, which is this will get worse before it gets better, can make people feel powerless. And if you are home, physically distancing in your house, maybe your children are home with you, you can feel even more powerless. And that is not how we should be feeling. Canadians should be feeling very powerful. And Canadians should be feeling powerful because each one of us can make a really significant contribution to our country getting through this and to our country avoiding the kinds of really nightmarish situations that we've seen in countries like Italy. And we can make that contribution by doing what Dr. New has described, by being really rigorous in practicing physical distancing. Now, that is hard for individual Canadians, and it is hard for Canadian companies. And that's why what Jean-Yves said is absolutely the case, which is the government is here to get us through this. We will provide whatever economic support is necessary for Canadians to do what it takes to get through this global pandemic. So I want people to be realistic, to do the hard things each individual Canadians need to do, but also to be hopeful, to feel very powerful, and to know that we are going to get through this because we are a country that knows how to act collaboratively and that knows how to listen to our experts.
Okay, so maybe one last question from the room and one last question from the phone. Mike, Global.
Dr. New, when the millions of items came from wherever, the PPE equipment that we were talking about yesterday, when is it actually going to get here? We were supposed to be sent millions of extra things from PPE from China and elsewhere. Has it shown up, or when is it going to show up?
Well, there's quite a range of equipment that certainly that's been ordered. We're working day and night, obviously, with our provincial and territorial colleagues to get the equipment into Canada. And I can't give you an exact time or date for all of the various pieces and types of equipment, but rest assured that we're looking across the globe and also, obviously, in Canada to ensure that we do have the supplies and equipment we need here in Canada.
For hospitals who are running out of PPE, what is the situation there? And can we guarantee that frontline healthcare workers are getting the protective equipment they need to do their jobs?
Certainly in terms of PPE, we recognize that the frontline healthcare workers, all frontline workers who are at risk of exposure due to dealing with sick patients, they need the PPE. And so I could say we're working. Right now, I understand, yes, that there are imminent shortages or issues in the hospital. The one thing I would also stress is that as we're working very hard to make sure that these workers get their PPE that they need, we would also remind the general public, I don't know if it's still the case, but there are a lot of people in the general public that wouldn't be, I would say, needing such type of equipment. Some people might be, to be honest, stealing them or acquiring them in some other fashion that's completely inappropriate. We need to save our PPE for those who need it, our frontline healthcare workers, and not for someone to put on their face if they're going to the grocery store to get their groceries. So I can't stress that enough.
Okay, one last question for the phone. For those who are still on the line and want to stay on for the next press conference by Minister Morneau, please do. You don't have to re-dial in, but we'll take one more question on the phone.
Thank you. Merci. Our last question is from Mary Bastel avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour, M. Duclos. J'ai quelques questions sur la décision de fermer les bureaux de Service Canada.
The decision to close Service Canada offices. Can you hear me?
Oui, Madame Bastel, nous entendons.
Yes, we can hear you. Go
Donc,
ahead.
sur les bureaux de Service Canada, M. Duclos, il y a des gens
Service Canada
qui sont
offices, and there are
inquiets ce
people
matin
who are concerned this morning
d'entendre que les bureaux
to hear
seront
that
fermés
these
alors qu'il y a déjà
offices will be
énormément de
closed,
demandes
even though
d'aide
there's
qui ont été
a
acheminées au gouvernement.
demand for
Comment
assistance
ça
from the
se fait
government?
que ce n'est pas considéré
How
un
come
service essentiel
we
dans le
didn't
contexte où
consider
on se
these
trouve?
essential services in this situation? Answer. Thank you for your question. I would like to answer generally at first and then give you more details after. Generally, what we absolutely have to do is to serve Canadians in need, and this involves services offered by Service Canada. But we also have to protect the health and safety of employees of Service Canada. In recent hours and days, we've had incidences where employees of Service Canada saw their health and safety at risk. And like any responsible employer, when this happens, we have to react to protect the health and safety of our employees. So, Service Canada services will continue to be offered in four ways. First, by significantly increasing the number of agents that work, for example, EI. There are more than 1,000 employees that were redistributed to this program. Employment insurance. And second, we're going to ensure that employees can work in a safe environment by offering them appropriate measures to offer services by telephone so that people can receive the services that they're entitled to. And third, some people who have issues accessing these services, whether they have mobility issues or they have a particular disability, these people will be able to have appropriate services offered under specific conditions. This is offered in both a respectful way and a responsible way. And lastly, we'll continue to ensure that requests for EI coverage requests that were made after March 15 will move to the new emergency benefit so that people don't have to follow up with EI. These requests will be naturally sent and easily sent to this new Canada emergency benefit that we announced on Wednesday. So, overall, we're protecting the health and safety of the Service Canada agents, and at the same time, with Wednesday's announcements, we're offering additional services with the CERB so that Canada can deliver services and benefits that Canadians are entitled to on normal times, during normal times, but also during a crisis
mais en
as
suivi,
well.
vous dites donc cette série de mesures qui, selon vous, vont accélérer l'accès à ces prestations-là, mais vous parlez notamment des 1 000 employés qui ont été qui ont été redirigés vers le programme d'assurance-emploi, mais ça, c'était déjà le cas dans les derniers jours avant que vous fermiez les centres de Service Canada. Donc, est-ce que vous allez mettre plus de monde au téléphone ou d'une autre manière pour aider les gens qui ne peuvent plus aller au centre de Service Canada demander ces services-là? Et mon autre question, c'est And my other question is,
de votre projet de loi C13, il semble qu'il est interdit de demander la prestation d'urgence si on a quitté volontairement notre emploi. Or, les gens nous disent peut-être que quelqu'un a quitté pour s'occuper de son enfant parce que la garderie est fermée, ou quelqu'un qui parce qu'il ne se sentait pas en sécurité d'aller travailler alors que la santé publique dit justement de rester à la maison. Qu'est-ce que vous dites à ces gens-là qui ont l'impression qu'ils ne pourront pas demander la PCU parce qu'ils ont quitté volontairement leur emploi?
Because they voluntarily left their job and they're in that
La réponse
situation.
est oui à vos deux questions. La première question au sujet des services de Service Canada, en raison de la fermeture
because we physically closed
des
Service Canada
locaux,
offices,
en raison de l'incapacité pour les agents du Service Canada de
because their
recevoir les gens
agents
en personne, ce qui se passe,
weren't
c'est
able to help
que du
people
temps
in
et des
person.
ressources additionnelles sont
We've
maintenant
added
disponibles
additional time and
pour répondre
resources
aux appels et pour
to
traiter
allow
les
them to
demandes
answer
en ligne.
calls
Il y a
and
une très grande
fulfill
majorité
online
de ces
requests.
demandes qui sont soumises
So most of
en
these
ligne,
requests that
et
are
donc le
submitted
fait que les
online
agents soient moins en contact physique avec les Canadiens leur donne plus de temps pour recevoir les appels et traiter les demandes par Internet. Et la deuxième question au sujet des normes et des conditions pour recevoir la prestation canadienne d'urgence, des précisions ont déjà été fournies, mais il y a beaucoup d'autres précisions qui vont être fournies au cours des prochains jours. On entend très bien non seulement l'intérêt des Canadiens pour cette nouvelle prestation, parce que je pense que les Canadiens comprennent que c'est une prestation qui est mise en place dans un cadre d'urgence, dans un cadre de crise. On n'a jamais vu un gouvernement canadien dans l'histoire du pays, certainement pas depuis la Deuxième Guerre mondiale, mettre en place de telles mesures d'urgence. Donc on le fait à la vitesse grand V. Les Canadiens et les Québécois en particulier posent
Quebecers and
normalement, et
Canadians
c'est
in
tout à fait
particular
légitime,
are
des questions importantes.
asking legitimate
Il y a encore beaucoup de
questions,
questions auxquelles on doit apporter des
and we will
réponses.
be
C'est pas juste
providing
des réponses, mais
answers
c'est des bonnes réponses.
and
Et on
good
aura ces bonnes
answers
réponses prochainement.
in the coming future.
Merci,
Thank you.
ceci met fin à la conférence de
That
presse.
ends our
Comme je l'ai
press
dit, s'il vous plaît,
conference
restez en
for
ligne
today.
si vous voulez
Please stay
assister
in
à
line
la
if you want
suivante.
to participate in the next
Thank you.
conference.
Merci.